Hello everyone, and thank you for watching this evening. Also, thank you Dr. Naumann for being here with us. Tonight we'll be discussing pneumonia, common symptoms, and treatment options our clinic can provide. If you have any questions, please write them in the comment section to be addressed at the end. So Dr. Naumann, can you briefly define what pneumonia is?
Sure. Pneumonia is a viral, bacterial, or fungal infection that affects one or both lungs, causing the air sacs, or what we call alveoli, to fill up with either fluid or pus.
Right. So what are the common signs and symptoms of pneumonia?
Well, it's kind of what we would think about. With community-acquired pneumonia, you're going to have a cough. And you have to remember, it could be either a productive cough or a non-productive cough. You can have a rapid heart rate. You can have fatigue, certainly fevers, chills. Difficulty breathing, of course, is one of the big ones, and that could be something like wheezing, shortness of breath, painful breathing, or even a fast breathing rate, faster than normal breathing.
All right. To provide you all with a visual, we have some x-rays that we had pulled from the University of Virginia's website. Dr. Naumann, can you show and explain to our viewers what pneumonia looks like on an x-ray?
Sure. So here's a classic x-ray. This is your lungs, your two sides of the lungs, and this is your heart hanging here. So the classic, what you want to do is you want to compare both sides of the lungs, and see, as you can tell, there's a nice difference in this one. I wouldn't say nice, that's probably a bad word, sorry about that. This is pneumonia. So, but you can clearly see the difference on this side. This is where the pneumonia is in this patient, and this is where those air sacs have filled up with pus or fluid, and it's just become a solid mass, and so no oxygen is getting through there, and therefore you're going to get that shortness of breath and coughing and that kind of thing. So this is a really, oops. Oh wow. You got it? All right, that's good. That's good.
All right. Is pneumonia contagious?
Certainly it's contagious. A lot of people don't think it's contagious, but it is contagious.
All right. Are there any demographics of people who are more susceptible to catching pneumonia?
Yeah, there's groups of people that we've identified over the years that are higher risk for pneumonia. Anyone can get pneumonia, but certainly anyone over the age of 65, anyone with diabetes, anyone whose immune system is a little bit compromised, going through chemotherapy or has HIV or any of those kind of things, or any kind of illness that would lower your immune system. Anybody with asthma, COPD, emphysema, any of those lung diseases, chronic lung diseases. And also, a lot of people forget about this one, is the heart disease patients, people who have heart attacks or stents put in, or who have congestive heart failure or strokes. Any of those vascular diseases actually put you at a little bit higher risk for pneumonia. And don't forget about the people who have chronic liver disease and chronic kidney disease. And certainly the last one we all know about is the cancer patients whose immune system is really hurt.
Okay. When is pneumonia most common?
Yeah, community-acquired pneumonia, we see about a third of the cases in a year occur in the season of winter, the winter season. But to be careful, because that means 2/3 of the other cases of community-acquired pneumonia occur throughout the rest of the year. So be a little bit careful thinking about community-acquired pneumonia as a seasonal illness. It is, but it can happen all year round.
All right. Can it be prevented?
Sure, it can be prevented. Certainly we have vaccines. I think the vaccines have been really good about helping decrease the cases of pneumonia. Certainly the pneumococcal vaccine, the flu vaccine, of course, and even some of the other ones we don't think about, the vaccines, the pertussis vaccine, even the measles vaccine has been shown to cut down on the cases of pneumonia. And of course, the other way to prevent pneumonia is just good hygiene practices, washing your hands, disinfecting surfaces that are frequently touched, staying away from people who have big coughs. And those of you who are coughing, please cover that up with your elbow or a tissue that you're going to dispose of immediately. Remember, a germ, for an adult, cough with an open mouth can send a germ 20 feet across the room. So Just being good and smart about your hygiene is really a great way to prevent.
All right. How can HRUC help in treating pneumonia?
Yeah, I think if you feel like you might have some of these signs that we had talked about and think you might have pneumonia, we're certainly, Hampton Roads Urgent Care is certainly ready to help you. Our staff is really comfortable in diagnosing and treating pneumonia. From listening to your story, examining you, checking your oxygen level, getting an x-ray in the office if we need it, giving you a nebulizer aerosol treatment if you need it because you're wheezing, prescribing antibiotics if they're indicated, and certainly communicating with your primary care is all the things that we can do for you.
All right, Dr. Naumann, do you have any final thoughts on this topic?
I think one thing I do want to point out about chest x-rays, and that is early in community-acquired pneumonia, the x-rays aren't always conclusive. Some studies would say even only about 50% accurate. In other words, it takes a little while for all that fluid to build up in that lung tissue. So even though the x-ray might not show pneumonia, if you have signs and your physical exam confirms it, we're going to treat you as if you have pneumonia. We're going to start that therapy. We're not going to wait for that chest x-ray to catch up with how ill you are. The other thing I want to bring out some things is, it's a major illness, and sometimes we forget about that. A lot of people get community-acquired pneumonia, and our medicines are so good now on the outpatient side that, we give you medicine, you go home, you don't go to the hospital. Remember 20, 30 years ago, everyone with pneumonia went to the hospital. So nowadays, most cases, 90% are treated outside of the hospital. That doesn't take away from the fact that it's still a major illness and you need time to recover. Most adults take 2 weeks to a full month to feel even close to back to normal. So always keep that in mind. I know people and Americans are ready to get back to work as soon as possible, but give yourself time to heal. And the more you do that, the quicker you will heal and get better.
All right. Well, thank you, Dr. Naumann.
Thanks for having me.
All right, and thank you, everyone, for watching.